Good morning. Thanks to those in the room with us today. We are social distancing, so we don't have that many folks in here. We are under 10, which is what the governor's order was. My name is Roger Harrell. I'm the county health officer in Dorchester County. I've had the pleasure of serving in this job. I'm in my 24th year. In my 24 years here, this is one of the most exciting times for public health. And I say exciting because what we do in public health, and a lot of people don't know, is we go from disease prevention to crisis intervention, working in partnership with our community, with our leaders, to assure a environment, a health and safe environment where we can raise our families and we have kids graduate from high school, play and work. This particular disease we're talking about, the strain and virus, is new. It's new in such a way that nobody really in the community has the immunity to it. Everybody will say to us, well, it's like the flu. Well, yes, it is. It's transmitted like the flu, airborne. However, the difference being, and while we're doing what we're doing now with the governor's leadership, is for the flu, you have a flu shot. We know how to treat the flu. The various strains of flu that we've had before, so all of us have some immunity to that. Hopefully all of you got your flu shot like I did. I got my pneumonia shot because of my age. We have the vaccines. For this disease, for this COVID-19, we do not have a vaccine yet. We're working on that. We don't know really how to treat it. At the back end of this, the ones that are very ill, they develop pneumonia. So what do you do in public health when that happens? You go back to basics, and basics being is that you try to minimize crowds. And the superintendent and I had a conversation before it was announced by the governor on the next day and the superintendent of schools. He made some decisions because we said 250 people is max, and we had a school play coming up. We had some other issues going on. So the superintendent and I decided we're going to cancel the school play, and he caught heat that day for that. Well, why did you do that? Well, the next day, the governor made a decision to close bars and restaurants and issue an executive order. It's apropos that we waited till today. We're 2 weeks in because this started ramping up. I think the first cases were 3 cases in Montgomery County positive on March the 5th, and it's gone from there to where we are today. And when my deputy health officer, Dr. Scott, speaks, she will give you the numbers for the day. The good news is, and while we're talking about testing, is that a lot of the questions folks ask, well, why aren't you testing in Dorchester County? You must not be transparent because as of this morning, we still do not have any cases, any positive cases. What does that mean? That doesn't mean we're not going to have a case, because the more people you test, the higher probability you're going to find cases. What we do know on the shore, and Dr. Scott can address this, the total number is small compared to Baltimore City. The hot spots are in Baltimore City and on the Western Shore. So we're blessed to have that. But we're also blessed to have a governor who had the foresight to work with the leadership, Secretary Neal, Deputy Secretary Phillips, and other medical folks from Hopkins to make these tough decisions and decide at the 12th, where we are now, we're down to 10, no more than 10 gathering in the community. And from that standpoint, the transition is easy. You keep people 6 foot apart, because the closer you get to somebody, the more apropos you already have the disease pass to you. 6 foot is the distance. That's 2 arms length. 2 arms lengths out. If you stay there, you're going to be fine. The other thing you need to do after you've done that, make sure you wash your hands. Very simple things. For public health, that's something we do every day. Good hygiene. Use, if you don't have we like soap and water. If you don't have that, use use your little bottle of this, as I carry with me all the time, to use and wash my hands after I've been somewhere. My format for the day with this intro is to have three other people speak. One to offer the clinical aspects, who will come up. I'll introduce her as Dr. Casey Scott. And once Dr. Scott finishes, another partner we have to make these things work is law enforcement and judiciary. We're blessed to have in Dorchester County a state's attorney who's worked with us on a lot of other issues, Mr. William Jones, who's going to speak about the governor's orders and other things related, because they're the ones that help us enforce that. The third speaker, which is close and dear to my heart, because our children and education is the most important thing for public health in the long run, for a healthy community. Kids going to school, kids learning, kids graduating, kids having a school and adding back to their community. And we know that if that happens, the health of those kids is going to be better. And the reason we closed schools initially, because that is really like the incubator for a lot of diseases, and we know that through our school health program, our school-based wellness centers program. So the superintendent and I were on the same page that it had to be done, because that way you move the kids and the families back at home working. So he will be the final speaker, and then I'll come back and I will wrap it up and tie it all together for us today. So with that, I would ask Dr. Scott if she would come forward. She's a local person. We're blessed to have her. She grew up in Dorchester County. You always want to have somebody graduated from the school system and come back here to work. We're blessed to have Dr. Scott working with us at the health department as my deputy health officer. Dr. Scott.
Good morning. Thank you all for joining us for this public health information session on COVID-19. And thanks to those of you who sent emails. We'll do our very best to answer them today. I'd like to start by providing some basic background information. COVID-19 is a disease caused by a respiratory virus identified in Wuhan, China in December 2019. While coronaviruses are not new and typically cause common colds and upper respiratory infections, this coronavirus is new to humans. Worldwide, COVID-19 has resulted in over 450,000 infections, with over 61,000 cases here in the United States. As of this morning, Maryland has 580 cases, 3% of which are on the Eastern Shore, and we still have 0 confirmed cases here in Dorchester County. COVID-19 is spread from person to person, much like the cold or flu. When people cough or sneeze, respiratory droplets form and can come in contact with others. It can also be spread through close personal contact, such as touching or shaking hands, or by touching objects or surfaces with the virus on them. Symptoms of COVID-19 include fever, which is a temperature of 100.4 degrees Fahrenheit or higher, cough, shortness of breath, and in more severe cases, pneumonia. Most people who become infected will recover and will have mild symptoms. However, people with underlying medical conditions, those who are immunocompromised, and the elderly have a higher risk of complications. There are many questions regarding testing, when it is needed, how to request a test. I assure you testing is being done here in Dorchester County at your private doctor's offices, urgent care centers, and at our local hospital. We report the number of confirmed cases, and again, as of this morning, that number was 0 in our county. Unfortunately, we cannot provide an accurate number of how many people have been tested. These numbers historically are not reported to the health departments, only the positive cases are. Our state health department is working with a multitude of labs conducting the COVID-19 test to attempt to capture this data. In addition, testing is only indicated in certain circumstances. Local healthcare providers have been directed by the Maryland Department of Health to follow the Centers for Disease Control, or CDC, testing criteria to determine which patients should be tested. These criteria change over time, but our state health leaders have done a great job keeping our local providers in the know. There is still a lack of test kits nationwide, and we are feeling this locally as well. At this time, the CDC is not recommending testing for asymptomatic individuals, that is, people without symptoms. If you have symptoms, such as fever or dry cough, please call your healthcare provider for specific guidance. You may be instructed to remain at home and monitor your symptoms. Please refrain from using the emergency room unless you have severe symptoms, such as difficulty breathing. We need to reserve these resources for those who are most sick. Whether our case count is 0 or 10, our guidance to you as our citizens remains the same. The best way to protect yourselves and your families is to practice social distancing. This means keeping at least 6 feet between you and other individuals, staying home as much as possible, washing your hands and household surfaces frequently. Work from home if you are able, and avoid non-essential travel. I'd like to give you a few resources that you may want to reference in the coming days or weeks. The health department has a call line staffed by nurses that is available to residents Monday through Friday, 8 a.m. to 4:30 p.m. You can reach us at 410-228-3223. After hours, you can dial 211 for COVID-19 related information. We also update our Facebook page frequently. That's Dorchester County Health Department Emergency Preparedness. And the Maryland Department of Health website, coronavirus.maryland.gov, has a wealth of information you may find useful at this time. This is indeed a challenging time for our community and our nation. At a time when we are encouraging you to stay away from others, we realize that we need one another's support as well. Reach out to your neighbors, check on your elderly or homebound family members, and consider what you can do to help our community rally and emerge stronger than before. Roger.
Thank you, Dr. Scott. The next individual I'm going to introduce, I'm going to stay on this theme. He's a graduate of our school system too and stayed home. He's now our state's attorney. He's had a varied career. But our school system has another product, Mr. William Jones, who's a great partner with me in a lot of things that we do, from opioids to education and the court systems. And I'm proud to have him come up, and he's representing the judiciary along with law enforcement today. He's a key to our success in Dorchester. Bill?
Good morning. Thank you, Roger. I appreciate your kind words. And I'd also like to say that I appreciate Roger and the incredible work and leadership that's given to us from the health department. I've had a chance to see for the last couple of weeks their tireless and comprehensive work as they work to protect the citizens of Dorchester County, and we're being very well served by them. I'd like to talk for a moment about the governor's executive orders. Governor Hogan has issued several executive orders regarding social distancing, sort of making legal certain social distancing practices that we need to follow. Those include limitations on the size of gatherings, the closure or restrictions of certain businesses, and other activities that are designed to protect the public by slowing down the spread of this virus and hopefully helping our healthcare system from becoming overwhelmed. These limitations include prohibitions on gatherings, 10 or more persons, the closing of non-essential businesses, placing restrictions on businesses that are allowed to stay open. We recognize the hardship and the sacrifices placed on many, some more than others. The governor is serious about the enforcement of these measures, and that's simply because these measures will save lives. Law enforcement is checking for compliance with these measures, but I will say that interpretation is not always simple. When we read these orders, we understand that there are some gray areas, and we try to work through that. I can tell you that we are assisting state and local law enforcement in interpreting these directives, and from time to time we get assistance from the governor's office with that. Anytime anyone has a question about interpreting these orders, are free to call the state's attorney's office for guidance, and if we don't have the answer, we will certainly help you find it. Those who violate these orders are subject to criminal prosecution, which can lead to a year in jail or a $5,000 fine. I can tell you that here locally, we are hoping to charge no one with any of these violations. If we receive calls or information, law enforcement receives calls and perhaps hears of a violation, they respond to investigate that. Their first response, in conjunction with directives and guidance that we've issued, will be to educate those perhaps who have committed a violation. We're trying to abate this situation. We're not trying to charge people, we're trying to fix it. But I can say this, willful violations, those that are not abated, they may result in those responsible for being charged criminally and may include arrest. But I understand, again, that this represents a real hardship. We understand that small business is the backbone of our economy, locally and nationally. I've been asked to share with you from the Chamber of Commerce that on Monday afternoon, 2 p.m., there will be a webinar for businesses in Dorchester County. The webinar is being presented by the Dorchester County Economic Development, the City of Cambridge Economic Development, Cambridge Main Street, Dorchester Chamber of Commerce, and Maryland SBDC. The webinar will provide an overview of funding options available, review considerations for continued operations, and the executive orders issued by the governor. Details on how to sign up will be posted early Friday, and you'll be able to find information on the websites and Facebook pages of the presenters. I'd also like to take a moment and talk about criminal activity. We are told, we've heard, and we know that there are scams operated by those who would use this public health emergency as an opportunity to victimize our friends, our neighbors, and our fellow citizens. Those scams may include the selling of alleged vaccines and cures for the coronavirus. And since none exist, these are almost certainly attempts at criminal behavior. Also, with the government working on a stimulus package, Related to this situation and hope to sort of keep our economy going, we anticipate that the government will be sending funds to some citizens. However, government will not contact you and ask you for money up front. Anyone who does so is trying to scam you. Be wary of anyone who contacts you and asks for your personal information or money in order to receive your stimulus check. That just won't happen, not lawfully. Any such contact is likely fraudulent and an attempt to steal your identity or perhaps your property. Understand, related to criminal activities, that law enforcement agencies, the sheriff, the Cambridge Police, Hurlock Police, State Police, they're still out there doing their jobs. I assure you that anyone who views this public health emergency as an opportunity to commit crimes and victimize our neighbors will be dealt with severely. Any questions regarding possible scams or compliance with the governor's executive orders can be directed to law enforcement or to my office, the Office of the State's Attorney. Let me say again, the governor is serious about compliance with these orders, and here locally we are as well. While I recognize the hardship this places on many, we must remember, this will save lives. We are in this together, and together we will get through this. Thank you.
Thanks, Bill. And other jurisdictions are not as blessed as we are to have a state's attorney who will get this involved with us. We know it doesn't happen in other jurisdictions, but when I have an issue, I can pick up the phone and he's always there. He's there to help us and with law enforcement. We're blessed in Dorchester again, and we're blessed in this educational system because we have another product of the system who's now our superintendent, my friend Dave. Come on up, Dave Bromwell. Another example of what we do with education in Dorchester.
Thank you, Roger. What a first year as superintendent. I never would have thought we'd be in the boardroom here down at the central office talking about such a pandemic that's taken over our country and the world, but certainly affects us. But you have to go out and you have to thank the people that are here, whether it's the mayor, whether it's the county council. I'm so proud to be a Dorchester County Public School resident, born and raised here, that our community has really rallied around this entire event. And, you know, I think because we don't have a case at this point that, you know, shows that we're all in this together and we're going to do the best we can to deal with it. As Roger said, very concerned with education, instruction, and the term that's being used, the phrase is continuity of instruction for our entire county and the state of Maryland. Dr. Karen Salmon, as I'm pretty sure everyone knows, has closed their schools till April 24th. It's basically over a month that our students have been out of school. There's no question after just this past 8 days, and this is day 9, our students and staff want to be back to work. And I know our parents want our kids back in the school system as well. So with that, when this first happened, the entire state, every county was beginning to work on how we can push out instruction to all our students. Not an easy task. If you're in Montgomery County, you're in Baltimore County, any of the larger counties, you have access to online services and you can push material out to students. Easier said than done with rural counties. If just this minutes before this press conference took place, I was on a press conference with Zoom conferencing with the local superintendents, and we're going to all be pushing out hard copy instructional packets to all our students. Now, we're focused presently on our high school students at the secondary level because all of these students are working toward a graduation credit or graduation. So we're really focused on them at this point. We're going to be pushing out 1,000 computers, and we're going to be providing hotspots at all our schools. Not only that, we're working with our local fire departments, what again shows how much we work with fidelity throughout the county to see that our students, if you were at Hooper's Island, you'd have to drive all the way to South Dorchester K-8 to receive some kind of hotspot. But, I know local businesses and our fire departments are working to make this easier on parents and students as well. But again, even with all that, being in Dorchester County, we're the largest county in the state of Maryland when you include our marshlands and waterways, which makes it very difficult to have internet access, online hotspots for our students to be able to communicate with their teachers. But we're going to do our best with that. But again, we're also going to be pushing out hard copy packets, 4 weeks worth of work to our students, and we're going to do the best we can at each school to pass this information out. This has been a daunting task. When you think of 4,700 students in Dorchester County, and now our 13 schools are trying to push information out. And again, I have about, 7, 8 questions here. What about seniors? What about graduation? We have been working with the state superintendent on that, on is there going to be days that are going to be waived? Is there going to be requirements that are going to be waived? At this point, we do not know that. I had a great question about just online access. How come Dorchester County Public Schools was not ready? Well, we're just like every other shore county. It's one thing to be able to hand a student a device, whether it's a Chromebook, whether it's a laptop, all right? It's another thing to have access where they could actually receive internet access wherever they live. And again, when we're this large a county, it's virtually impossible. Again, I want to thank all the local businesses that are working with us to try to make this happen. I think, it happens all the time, and it's a sad thing to say that when you have a disaster type situation, suddenly you realize we need to move on things a lot faster. And we are moving, and I do believe within 2 to 5 years, this is forcing every county in the state of Maryland to provide a one-on-one device for every student. But again, you're talking dollar signs when it comes to that. But we're starting to plan on that. We had actually been planning on it. We've just had our hand forced on it. I think I said we're going to continue our food distribution throughout this entire process. It started out slow. Just the other day, I think it was Monday, we had over 800 food bags that were handed out. And when you consider that there are 3, you have breakfast, lunch, and dinner in there, that's 2,400 forms of food that were passed out in our community, which is just awesome, and it's going to continue to grow. And again, I want to thank our cafeteria workers and all the people that have volunteered to help out, reach out to our students. One of the other questions I want to get to, I haven't canceled anything yet. So those people and parents that have seniors, I feel for you. This is one of those moments that you mark in history in your family's life that you want to celebrate. I'm going to do everything I can to make sure a prom, a graduation, all those things take place, even if it's into the next school year. With that, thank you.
Thank you, Dave. You hear the passion in his voice and how he cares about education. Today's event, I want to do a quick thank you out to the person that really made this happen on my staff, who's taking over the Joint Information Center, and that's Miss Angela Grove. She's done a super job. That came about because as we got into the early days of this, I was asked by the county council, since it was a public health issue, if I would take on the health department and run a Joint Information Center, and that makes sure that everybody in the county is on the same page when we're releasing information. And I want to thank the council for entrusting me to do that. I want to thank the council also for wrapping this up to another level and making it a full-scale emergency, which allows us to draw down resources from the state level as well. We couldn't do it without that. We couldn't do it without the other partners that aren't here today, with my EMS, my emergency management, my volunteers in the community who are out there on the front lines every day, and us making sure that they have the proper PPE in order to do their job. Law enforcement as well. we've been preparing for this for a long time. What I will say to folks, typically, what our greatest thing, and the mayor who's here with us today will verify this, and hurricanes. Hurricanes, we had a number of them since I've been here over the years, and we've never lost a person, even though in the middle of the night when we thought we had to find somebody and you had to get a Coast Guard helicopter to go looking for them. So the system works. The difference here is I'm the incident commander because this is a public health emergency. But I don't do it without the support of the individuals in this jurisdiction. And I'll begin with thanking the President of the County Council. I've had the pleasure of working with him off and on over the last 23 years. Jay Newcomb, who's with us here today, who's always been supportive. He's an EMS guy himself. He's worked for the fire company, so he's got boots on the ground. He understands it. We're blessed to have a mayor, Mayor Victoria Stanley, who gets it as well. In her previous life as the Deputy Director of Social Services, she helps me tremendously, even now in a volunteer status with us, of how we should do things in Dorchester County. Another product of Dorchester County school system. You're a product. I'm not the product. I'm a product of North Carolina. But I count our blessings because oftentimes our school system gets chastised, and people come to say, you don't have the best school system. You heard them today, folks. This school system turns out some great products. And for me as a health officer, we don't do it alone. Because when you look at health status has to do, did somebody go through school? Did they get educated? Did they get a trade? Did they get a job? Yes, ma'am, thank you. And yes, these are the examples. And for the first time, I'm happy to have somebody from Hurlock with me today. I have the manager of the town up there, John Avery, and they oftentimes are forgotten. So anybody that's listening from North Dorchester, we don't forget you. We know you're there. I worked with Reverend Cephas over the years. We know, but we don't run a lot of programs up there. And so when I heard that John was going to be with us today, I was excited because the chief up there of police, I know, has been participating with us in our joint calls as we do every day to share what's going on in Dorchester County. Once again, couldn't do it without partnerships. And elected officials, they're key to what we do. Town managers, not here, but does a super job working with us. Other elected officials from Hurlock's council, the city council, don't name all of them, but they're for us. Because it's unique in Maryland. Somebody asked me one time, and I think the charter does have something about the health officer. I'm the health officer for the entire county. Maryland has a health officer in every jurisdiction, plus the commissioner of Baltimore City. And sometime they asked me one time, are you the health officer for Cambridge? I said, yes. I'm the health officer for the entire county, even though I'm hired by the appointed by the local county officials. Today was an opportunity to bring to you the message about what we're doing, but at the same time, I think to celebrate Dorchester and celebrate some of the things here. So I've taken this opportunity to do that. Hopefully the message comes out to our citizens. And we want to thank you because we've had very few complaints come in regarding these executive orders, which says a lot about the community taking it serious. They are staying home. They're not wandering out. They're not gathering in places of more than 10, as they are in some of the jurisdictions. The essential message is that you can go out for essential supplies. You need groceries. You need medicines. And as long as there's food on the shelf, you need to go get food. You need to get your medicines. There's some things to relief now where you can get more of a prescription than you would before as well. It's out there. But we ask that when you do go out, pay attention. In the Walmart or wherever else where you got a lot of folks in there, keep the 6 foot. We haven't put down little X's. I saw in the national media the other day, one of the big stores put down little X's and showed you where the 6 foot was. We use this here as a 6 foot. More importantly, something you should do every day, whether it's the COVID-19 or a cold, wash your hands. 20 seconds, soap and water. It works, folks. Wash them often. You touch surfaces. We know that this lives on surfaces. As soon as you do that, wash your hands. Put some handy wipes in your vehicle. Wipe that down when you get in there. Use this to wipe it down. We ask that you do that. If you do that, you're protecting yourself and you're making sure that you protect the folks around you as well. If you don't feel well, that's when you need to start thinking about it. You start running a fever, you get that, contact your private physician. If you don't have one, contact the urgent care center, and if all else fails and you don't have a healthcare practitioner, call the health department. We'll see what we can do to help you. We're here to serve you. But you need to, at that point, self-isolate. And we know that staying home is a challenge, but Dorchester County is staying home right now, from my observation and where I've been around. The last thing I want to address is that somebody asked, well, what happens if you get the first positive case? Well, when we get the first positive case, I've got a team of nurses and staff, and led by Dr. Scott, that's going to start talking to that person and find out where you've been. They're going to have a bunch of questions they're going to ask you. If you can, and the physician says you can stay at home. And when that happens, we're going to have to check on you every day, and we'll be getting temps, and we're going to be doing some other things. It goes back to when the superintendent started talking about connectivity, and on one of my calls with the rest of the state, they said, well, everybody should have a tablet, so when you self-isolate, just check them, via telemedicine. Well, it doesn't happen down below in South County. We can't do that, so we got to have other ways to go out. We would minimize the contact with our staff going out to make sure the client is taken care of. But we don't have that resource. Eventually we'll get it. Broadband's something we've been working on. Council's taking the lead on it at times. It's not where we need it yet. But Dorchester has a lot of things to be proud of, and I want to talk about us being proud during an event of this, to where we're talking about how we handle things. I want to thank all my volunteers. I want to thank all my leaders that are here today. Thank them for their support. Thank them. When I called Sheriff Phillips, he'd pick up the phone immediately, and we can go back and forth. Actually, he and I canceled a couple things, not knowing what was going to happen, big events even, before they happened. And the superintendent as well, when he and I said, well, we need to cancel school play. It's that type of partnership that makes us successful in Dorchester County. Hopefully I've wrapped up everything my folks had to say here today and tied it up in a bundle for you, and that's entertain any questions if the press has any. But otherwise, thank you for your time. Thank you, Dorchester County, and the residents who are watching today. Thank you so much.